Good afternoon. I'm Jim Weatherup, Chairman of the Oswego County Legislature. Today is April 3rd, 2020. Thank you for coming today, and thanks for your efforts in keeping our citizens informed of our county COVID-19 response activities. With me today are Dr. Christina Lipke, Oswego County Health Department Medical Director, and Dr. Dwayne Tull, Chief Medical Officer of Oswego Health. First, I wanted to share with you the wonderful news that 9 of our residents have recovered from the coronavirus and have met the criteria to no longer be quarantined. This is great news for our community, and most people do recover from this disease. So far, our numbers have been consistent with the state and national averages. Most COVID-19 patients can recover at home, and that has been our experience. I want to review with you some of the steps that Oswego County government has taken to protect our residents and reduce the spread of the virus. First, I want to assure you that our health professionals, first responders, law enforcement, human service agencies, and many other partners are working around the clock to make sure Oswego County has the equipment and resources to protect all of us, both the sick and the healthy. For several weeks, we have held daily briefings in the Emergency Operations Center in Fulton to coordinate response, identify issues and unmet needs, and work together to make sure the agencies are getting the resources they need, whether it's shelter for quarantined first responders, personal protective gear for our EMS teams, or food for our vulnerable populations. On Tuesday, March 31st, the legislature passed a resolution creating an account with $500,000 from our fund balance to pay for COVID-19 related expenses that have incurred to date and to cover upcoming expenses. This move allows the county to track expenses if there is an opportunity through FEMA and other agencies for reimbursement. We currently have spent more than $150,000 as we combat and prepare for COVID-19. Our biggest challenges are finding sources of PPE and other supplies for our first responders and healthcare workers, as well as identifying locations to isolate or quarantine people who cannot do so at home. By and large, our community has done a great job practicing social distancing with 6 feet of separation and hand washing, among other coronavirus-related precautions. There remains pockets of groups, for the most part young adults, that have resisted either through a belief that it won't affect them or a more troubling thought that it's a matter of fate. What they don't realize, apparently, is their ability to then spread the virus to other groups. This could then involve their family, friends, and most concerning, the very young and the elderly who may have compromised health issues. There's been a lot of conversation about where patients live, work, and shop. I can assure you that our health department conducts a thorough investigation in every confirmed case to notify any known contact who may be potentially exposed to the virus. Their criteria is based on epidemiology, not scare tactics or hearsay. If it's determined that a patient may have exposed others in a store, workplace, or other public setting, we notify the public of the potential risk, as we did yesterday. We've come under a lot of scrutiny and criticism from citizens and even other elected officials about how much information to release about individual patients. I can tell you this, from a health and safety perspective, and as a matter of privacy, it is both ill-advised and inappropriate for us to release more information than we already have. To the social media fearmongers, I ask you this: if you or someone in your family had a contagious or communicable disease, would you want us to put your name and address on the front page of the newspaper? Would you want people parking outside your house, taking pictures of your home and your family, threatening you and your family with harm? I think not, and we are not about to subject those unfortunate individuals to that. If you are concerned about your health and safety, protecting yourself is easy. Follow the recommendations of the medical professionals, stay at home, only go out for essential needs, and if you do, practice social distancing. Finally, as we and others have said before, it doesn't matter where a patient lives, this virus is everywhere, and if we don't practice protective measures, it will continue to be transmitted throughout our communities. With respect to sharing updates on the current conditions within Oswego County, all chief elected officers, state and federal representatives, and county legislators receive a daily situation report that provides COVID-19 test results, including positive cases, and an update of daily operations, logistics, and planning. Once a positive result is verified by our health department, We reach out to share that there is a positive with a chief elected officer in that person's town or city. We do not reveal where specifically the person lives, just that there is now a positive. Every town and city in our county has someone that is either in precautionary or mandatory quarantine. This virus doesn't recognize boundary lines between areas. Much like other counties in our region, our way of dealing with coronavirus cases in public is to keep that information private unless the health department believes there is a gap in finding people who were exposed to the identified or to the infected person. Officials must balance public safety with protecting the privacy of affected individuals who have done nothing wrong. Investigations are going on behind the scenes, and county health officials are erring on the side of caution in determining who needs to be contacted, reaching out to more people than is probably needed. Local employers are often releasing limited information publicly after conferring with the health department. Thinking that you are safe because it's not in your town is not accurate, nor is the fact that it is in another town you can't go there because of the danger. We all need to be aware of the preventative measures and practice them to the best of our abilities. Since we began this effort, our health department has answered thousands of calls on its hotline. The department's COVID-19 page is updated daily. Other public information offices have issued 16 daily updates and another 57 news releases to local and regional news media, and we greatly appreciate the media's support in helping us communicate important information to our citizens. We've recorded and posted videos on various topics, distributed to the media, and posted on our website and Facebook. If people depend on reliable sources of information and do what they are supposed to do, we can help control the spread of this disease. We are all in this together. Now I will turn to Dr. Christina Lipke, who will give us an update on the health department's activities. Doctor?
Good afternoon. Thank you for your interest in being here today. First, I'd like to report on our numbers. These numbers are current as of 2:30 today. They obviously do change. The number of people tested to date is 587. The number of positive cases of COVID-19 is 29. The number of negative results is 485. The number of pending results is 73. I want to echo the chairman's remarks about social distancing. We cannot emphasize this enough. Even if you are wearing a mask in public, it is important to keep that 6 feet of distance between others and those you do not live with. I'd also like to address some of the questions and concerns that we've been hearing from the media and the members of the public. There's a lot of confusion about the differences between isolation and quarantine. I'd like to explain what that means kind of simply. So quarantine is for people who may have been exposed but are well. Maybe they traveled outside of the country, or they had some level of contact with somebody who's positive. Isolation is for people who are sick with COVID or tested positive but do not have symptoms. We also hear a lot of questions about where and how people can get tested. The Oswego County Health Department follows the State Department of Health guidelines on testing. You really must call your doctor or the health department in order to be tested. Our number is 315-349-3330. COVID-19 testing is authorized if you've been quarantined and developed signs and symptoms, if you'd had negative testing for flu or other respiratory viruses and you have signs and symptoms of possible COVID disease, if you've traveled to certain areas that have sustained transmission of COVID-19 in the last 14 days and have those symptoms. Also, if you have had close contact with a confirmed case and you have those symptoms, or if your physician is seeing you in their office and they're concerned and they call us, we do authorize that testing. We do not test asymptomatic people. We do not have 1 million tests, so we will not be testing asymptomatic people at this point. Testing is by appointment only, and all tests must be authorized by the Oswego County Health Department. Staff needs to be able to prepare for the patient tests before they arrive. In Oswego County, testing is done at the hospital and Pulaski Urgent Care. The drive-through testing takes place at the hospital. tests are currently being sent to the New York State Department of Health Lab, which is Wadsworth, and LabCorp. The average turnaround time for results varies, and we've heard anything from a couple days to 10 days. We have absolutely no control over this. At this time, the county can meet testing needs.
Thank you, Dr. Lipke. I'll now introduce Dr. Dwayne Tull from Oswego Health.
Hi. One of the questions is, how are we prepared? Oswego Health has been working on this project ever since January, when this was declared a public health emergency. In March, when the first case was presented in Oswego County, the key medical staff, senior leadership, and all of our nursing staff at Oswego Health have been working actively to try and work on this issue. Our response to the pandemic is in cooperation with the county, with the state, and with the CDC guidelines. I'm very confident in our staff and in the support and training that we are doing. We are constantly, 24/7, training our staff to be prepared for the surge when it occurs, and we are ready. We have the supplies we need, and we have the staff to do and take care of these patients.
Thank you, Dr. Tull. Do we have any members of the media have questions today?
Yeah, mine is focused on the supplies and how competitive the process is. So I'm going to have a follow-up after this. But it's challenging, right, to get supplies. And you mentioned yesterday that the supplies that you did order, they were sent somewhere else. And so I'm wondering, how is that possible? But then also, did they send it somewhere like Oswego, or they just mixed up the names instead of Oswego, or?
Well, I'm not actually aware where it did go. They just told me that they were waiting for a shipment and it didn't come to our county, so I couldn't really speak to that.
And that was through the EOC, correct?
Yes.
So if you were asking about hospital supplies, is that your question?
Like PPE supplies.
So
PPE.
those PPE supplies that you referenced were for EOC, but
Right.
Dr.
I mean,
Tull could address hospital.
We're still working with all of our vendors and purchasing supplies. We have pre-orders out for supplies, and we do get supplies from the EOC. We have received shipments from people as interesting as Harbor Freight. We have all kinds of organizations in the area donating supplies. We pull everything we receive and we're distributing them as appropriate. One of the ways that we are protecting the supply of supplies is by the appropriate use. We are isolating patients that are at risk or high suspect. We are using full protection with them, but we are not treating the entire hospital as if everybody is at risk. If we do that, we will run out of supplies. And that's part of why, if you see our facility, we're not doing all of the things that some of the hospitals in Syracuse are doing. To date, I'm very happy to say we have had no positive cases in our facility in either staff or patients. And a lot of that is from the phone screening that we're doing, as well as the proper use of PPE.
And so you said that you ordered more supplies to come to Oswego then, correct?
Yes, we're constantly searching for supplies and new suppliers.
Can you tell me how difficult that process is and what it's like?
We have a very good team on that, the actual individual action of our EOC. I don't know that I could speak to how the supplies are actually getting there, but we do have a team of that working through purchasing, and with the $500,000 that we've seeded this account. The money's not an issue. If we need more, we'll get more. But the physicality of getting the supplies, I wouldn't be able to speak to.
And I know that the governor wants to create a central stockpile, and I know that he's looking to upstate to possibly, get some of those supplies that people aren't using. Have they asked you yet for supplies, or?
No, but apparently at 4 o'clock today, they'd like our inventory. At this point, we've seen it in a press conference, but we have not seen it under an executive order. We anticipate that if there is one, we generally get them overnight, and we would certainly react. And I think us as a community would be more than willing to help any other community we can, but we also got to make sure, and the doctors assured me that we have enough here at Oswego Health.
I mean, there was a conversation with the governor earlier today, and part of that conversation was talking about sharing supplies throughout the state. He's putting together a task force, And through that task force, they will be redirecting equipment and supplies as needed. But we can assure you that we are going to keep all of the supplies we need to take care of our patients before anything is sent. And his ask is actually very reasonable. He's talking about maybe 10 to 20% of any unused supplies and guaranteeing us he'll return them, but that could be a difficulty.
You said you have confidence if a potential surge was to hit this county. You said you haven't really been contacted by other counties for supplies as of yet, but how do you balance that confidence in the supplies that you currently have and that balance for willingness to share with other counties as needed?
I mean, for the hospital, part of that is cautious participation. Again, we're not going to give out anything that puts us at risk. One of the big questions that the governor keeps raising are ventilators. We've been asked in our surge plan to look at the number of ventilators or devices that could be used as ventilators, and in our facility, we have a total of 23. Okay, at most, we would be willing to give 3, 4, maybe 5, maintaining the others that we can then split and use for many ventilated patients. Every item, as this task force moves forward, we'll have to look at every item individually and would only transfer anything that we feel that we could either replace or we have adequate supply of.
In terms of testing, lots been made of that. It seems like testing has increased significantly in the county in the last, week probably. You mentioned right now we have enough tests. I know as a couple days ago that might not have been the case. Have we gotten more in the last couple days?
So we were pleased to hear from the hospital that LabCorp had sent back some viral transport media, and so then we did open up a little bit more testing. I think you probably are referencing a decision that was made that we couldn't, for a bit of time, test symptomatic contacts of positive cases who were not healthcare workers. That was only in place for a day or two before we heard from LabCorp, and we were thankful that they sent back some viral transport media. And we are, as a health department now, continually looking at solutions to our testing problem, as other counties are. Nelson from Finance has looked at 3 different companies that we may be able to partner with the legislature's generous, I forget what you called it, I am so not a politician here.
A pot of money.
A pot of money, oh boy. So we actually are anticipating arrival of another 100 tests for Oswego County Health Department, which we are excited about.
Yeah, one of the things that's also helping with testing, the labs are loosening their guidelines on what they will accept for a test specimen. And by doing that, there are other materials that are out there that we can use now. So the number of possible tests has gone up considerably.
And I guess as a follow-up to that, do you think testing will continue the volume of testing in the county will continue to increase?
I think the volume of testing in our county will have to increase as long as possible, given that the number of cases is increasing. Yeah.
Yes.
I've read reports of the 15-minute test being developed. Will you have access to that, and will you use it?
So, do you want to, or shall I?
Go ahead.
Okay. There are 2 tests that look like 15-minute tests. One is that presidential test, which tests for the actual virus. That test is supposed to go out under DoD contract first, and then to certain places. I forget the name of that physician who was speaking last night, who said that maybe it was going to those federally rural health areas like the Indian Health Service areas first. So we would not be able to access that right now. The second group of tests that looks like a 15-minute test is an antibody test. That's quite a different test. It doesn't actually look for the virus. So that test looks for your body's response to the virus. We are looking at that, and the hospital is looking at that. We have to be careful because that test can give you some false positives and false negatives. So you can imagine yourselves not wanting to have a false positive, nor would you want to have a false negative. So we need to be very careful before we make that decision.
Yeah. One of the other issues with a lot of these instant tests is they actually don't exist on the market at present. Several companies are saying the earliest they could even ship any of the kits would be the end of the month.
This one's for you, Jim. Obviously, you were there yesterday, the mayor of Oswego put forth a ban on non-essential travel. I guess is the county considering anything like that or similar to that at this point?
Well, you know, we certainly evaluate anything that we think can do to help, but at this point, it's discussion only. It wouldn't even, it's not, we don't think in the cards due to the, you know, the rural character of our county, you know, with some suburban tones too, but it's not yet.
And taking a ride with your family could be a healthy thing rather than being a negative. But getting together in large groups and ignoring social distancing, that's the problem.
From a county perspective, I'm sure you're aware, you know, the city has density.
Yeah.
The same with the city of Fulton. We don't have that density in the rest of the county, if that explains. You had a question?
Yes, Governor Cuomo's been speaking of hospitals partnering together to become one, so to speak. Do you see that happening in the foreseeable future?
That would be yours.
I mean, I know that's a big step, but
Yeah, I mean, one of the things, I mean, Haney's is a group that represents the hospitals in New York. And what they are recommending, if a facility has staff that are available to help in an area of need, the hospitals partner together to work those things out.
how about if there is a major influx of COVID patients and you have to kind of, you know, Oswego may look to upstate or that kind of thing, as far as moving patients around?
Well, I mean,
It sounds
part
like
of,
something Cuomo's been speaking of.
correct, and part of his governor's task force is set up to talk about moving patients, moving equipment, and moving supplies. So at the moment, there's no details on it, even though we all took time out of our day for a call today, but it's developing. There are rumors that patients have moved from downstate to Albany, but nobody has seemed to be able to confirm those rumors.
Okay, so the possibility is still open.
We are prepared at the at the hospital to both surge of our own patients as well as accept patients from other entities.
Thank you.
Of the 29 positive cases, have any of them been hospitalized?
No,
Um,
not at our
Not
facility.
Oswego.
Sorry.
Thank you.
No, but
Sorry.
that is a point that needs to be out there, that because of like the other end of the county, a great proximity to Syracuse, there may be people that live in Oswego County but yet are in a Syracuse hospital.
Correct. I mean, to be honest, we have had hospitalized patients with COVID-19 who are Oswego County residents. You know, for their own privacy, we don't release that information.
I have another question on supplies. I know you said that you ordered another shipment, right?
Yes.
When are you supposed to get that in, and what does your current stockpile look like? Are you confident in that you have enough right now?
I don't know the exact delivery date. We could probably get that to you, but as far as that, I have high confidence in our system, and at this point, we're more than set for what we anticipate our needs.
Once a person is confirmed positive, they're in quarantine for how long?
I'm
Or is
gonna
it
ask
dependent?
Diane, it is dependent on if you are a healthcare worker and essential personnel, so Diane loves details. She is a detail
Yeah,
person.
the requirements for mandatory isolation or quarantine do vary a little bit. So anybody that's under those precautionary kind of measures that we're watching to see if they develop symptoms are gonna, I hate to say serve out, but will be under quarantine for 14 days because we wanna make sure they pass that incubation period. But for those that may be sick and recovering, those times can be a little more flexible depending on how well they're progressing and whether or not they're an essential worker, like a first responder, healthcare worker. So they do vary a little bit.
And they have to be symptom-free for 72 hours?
Yeah, ideally, if they're gonna be released from isolation, we want them to be fever-free for 72 hours with no medication. It should be 7 days past when their symptoms started. and we want to see general improvement in their other symptoms as well.
Anything else?
Just a real quick follow-up on that. Is that the health department ultimately makes that decision on when somebody would go back or not?
Right, we
Yeah.
would, because we're doing those case monitoring, so we're talking and reaching out to those patients in isolation daily.
And obviously in conjunction with the state health department guidelines,
Yeah,
which
we're,
do change.
these are not guidelines that the health department or counties set up on their own, but there is state guidance put out by the New York State Department of Health that does change from time
It's
to time.
just changed on
Usually at 4 a.m.
Saturday.
All right, thank you all, but only through supporting each other and working together will we successfully come through this experience. Thank you again for your patience and cooperation.